Okay. Hello, I'm Sharon. I'll be your nurse today. It looks like I'm going to be placing a nasogastric tube today. Have you ever had one of these before? No? Okay. Well, as I'm doing it, I will explain everything I'm doing. It may be a little uncomfortable, but I'm going to explain it to you. And can I get your name and date of birth? Okay. And I'm going to listen to your tummy and feel on it and observe it just a little bit. So listen for bowel sounds, and then I'll palpate all 4 quadrants, and then I'm observing for any rigidity. Okay, so you look good there, and I'm going to assess the patient's level of consciousness. This patient is awake. They've told me they've never had one before, so I'm going to be sure to explain everything to them. First, I'm going to provide patient privacy. And I want to go ahead and measure out first before I put on my gloves. I'm just going to measure. I'm not going to coil it or anything like that. Okay, I'm measuring. I'm going to go from nose, tip of nose to earlobe to xiphoid process. And on a bigger patient, the xiphoid process may be a little lower. Okay. And I would mark it with tape, but because this tube has lines with numbers on it, I'll just document what number is at the tip of the nose after I insert it. So I'm at about 55 on here, so when I'm placing it, I will stop at around 55. Okay. So now I'm going to perform hand hygiene, put on gloves. And so I'm going to explain to the patient what exactly this is for, and I'm also going to raise the bed to a working height and elevate the head of the bed. Okay, and I'm going to elevate them so that they're in the right position for me to place this tube. I think that's about good. Okay, and I'm going to drape you with this just in case whenever we're inserting this, you may gag, you may even vomit. That's okay, that's normal. And I'm also going to give you a cup of water.
Unless my siblings are going to be there, it's just going to be my parents. I'm just going to wait.
Okay. I'm going to set up my tape. Okay. By placing that on there, so then I'm not going to place my tape directly on this bed rail. It'll be on that piece of tape. Okay. And I'm going to tear it down the middle, and then I'm going to buddy tape it. Probably could have done this without my gloves on. Okay. So I'm just going to set this on here. Not touching anything, it's just kind of dangling so it's ready when I need to secure it. Okay, so first let me coil this so that it kind of goes down more easy.
Do you want to do one bed or we do both? Yeah, one. Okay. You can talk about the other one.
Okay. Now I'm going to assess which snare I'm going to place this in. So I'm going to have the patient hold one snare and breathe through the other one. And I'm going to have them switch. I'm going to assess the nares and make sure, see if they've had any surgeries, if they've ever had any major issues with sinuses or anything like that. Before I do this, I would assess for that. It looks like we're going to do the right nair, and that anatomically, it's usually the bigger nair. So we're going to go with the right one. Got this coiled, and I'm going to give them a tissue if they need to blow their nose before. and a tissue just to have while we're doing this process. So they can use that. Here's an emesis basin, just in case they get sick or anything like that. And I'll explain to them that's normal, and that I will stop putting the tube down if they do vomit. So I'm going to get everything ready. I'm going to connect everything I need to connect, get all my suction ready. The best way to test if this tube is in the correct place is X-ray. Put this here. I'm not going to reach this. We're going to set it here.
You go first, yeah?
Okay, so I'm going to get my lubricant, and I'm going to make sure.
Yeah. Alright, so I'm
going to make sure that I use lube. Okay, so what I'm going to do is I'm going to place this down this nostril, and what I'll have you do is stay like this. I'm going to kind of tilt your head back, and when it hits the back of that oropharynx, I'm going to ask you to put your chin to your chest, and I'm going to have you take a sip of water and swallow, and then I will go from your oropharynx, which is like the back of your throat, down to the stomach. But I'll explain that to you when it's time to put your chin to your chest, okay? Okay. So I have my lube on here. Before I do that, let me get my suction so I don't have to go across the bed. We'll be on low intermittent. Let me just have this ready. Okay. Now can you put your chin down to your chest? I'm going to have them take a sip of water. Okay, and swallow. And as they swallow, this is not cooperating right now, but I'm going to make it work. And in a real situation, if I need resistance, I would stop or pull back. If they cough, I'll stop or pull back, and if they're vomiting, I will stop, but I won't pull it all the way out. Like it went in. We're not going to hook this up to station yet. Okay, so to send them down to X-ray, I'm going to tape it so that it doesn't move in between going from here to X-ray. Okay. Also pin this tubing down. Okay, so I have that, and I'm not going to hook up my suction yet because I have not determined placement of the NG tube yet. Okay, and so for this next video, we're going to irrigate and remove the tube. So that's all for this one.